Hi there, everyone. My name is Kacey Darling, and today I'll be talking about the new health promotion initiative for our hospital, the influenza vaccination program. So the primary goal of this program is to increase the influenza vaccination rates within the community. When looking at the importance of increasing the influenza vaccination rates within the community, it is also important to note that this will bring many benefits to the community throughout, including the following. Firstly, we will obviously see a decrease in the incidence of disease and influenza severity and symptoms within the community. The more individuals that get the vaccine for influenza, the less likely they are to have extreme symptoms or reactions to the current strain of influenza, because they already have the antibodies for their immune system to be well prepared and equipped to fight it. Not only this, but it will also lessen the burden of disease on community members. With the lessened severity, there will be less need for individuals to feel the need to seek medical attention for their condition. This in turn will lessen the burden of medical staff and providers, as well as lessen the financial burden of those within the community seeking potential medical assistance. Increasing the influenza vaccination rates also helped to protect the vulnerable populations within our community. Groups such as young babies, elderly, and immunocompromised individuals are not able to receive the vaccine. However, if everyone else in the community does, herd immunity can be achieved and these individuals can be protected. Increasing influenza vaccination rates will overall increase the community well-being and sense of protection throughout. Before implementing this program, it is important to collect the current data on the outbreak and vaccination rates within the community currently. This will give us a baseline to track from and monitor performance indicators and be able to analyze the overall effectiveness of the program. So in acquiring potential outbreak data and current vaccination rates, for our outbreak data, we want to monitor and assess potential outbreaks in viral transmission and frequency of new strains prior to an outbreak. And for vaccination rates, we want to be able to track vaccination status within the community currently. When we implement this vaccination program, we would first like to acquire the necessary materials and resources. This includes educational and marketing resources for campaigns, vaccination providers and clinic locations, as well as accessibility coordinations for interpreters and transportation assistance. This will help to ensure we are reaching all areas within our community and all members have the opportunity to receive a vaccination if they desire, while educators and marketers will help to push the importance of vaccination status and make sure individuals are aware of the program that is available to them. We would also like to partner with community organizations, local government, and current vaccination providers to ensure equal opportunity for all members of the community, and to set up multiple vaccination clinics to the public. These clinics will be wide-scale access locations such as schools and community centers. For our program's outreach capabilities, we strive to ensure we are reaching all members of our community through the use of multiple outreach resources. Using language interpreters, transportation assistants, online platforms, mobile vaccination clinics, as well as other methods, we aim to ensure equal access to our program and ensure that anyone that is looking to receive a vaccine is able to get one without stress. We also would like to further push and incorporate vaccinations into routine care. This will help increase access while still being convenient for those involved. This means being readily available at primary care provider clinics, pharmacies, and student and employee wellness centers. We would also like to work alongside and collaborate with insurance companies to ensure the vaccination coverage rates are high and that there is a very minimal copay, if any. We would work alongside with community organizations and local governments to cover any outstanding costs preventing individuals from getting vaccinated. Lastly, we would want to monitor and evaluate the program after everything is done. This would mean tracking performance indicators, as well as monitoring incidents of influenza within the population. This includes the healthcare and hospital utilization rates, as well as morbidity and mortality rates. Program monitoring is important to evaluate the effectiveness of protecting the community from influenza and identifying any challenges that might hinder the program and to optimize resources in the program overall.